as today marks 2 years since the CDC reported the first case of coronavirus in the United States. Since then, we went from learning the importance of washing our hands thoroughly to masks, then lockdowns, the vaccine, cautious reopenings, and now new variants. 2 years later, the pandemic is still very much with us. Let's talk about what we've been through and what might lie ahead by welcoming Dr. Jeanne, the director of the COVID response at UCSF, to the 9. Thanks for being with us, Doctor.
Thank you for having me.
Of course. I've read the words of doctors who treated the first COVID patient in this country. They likened it to doing a fire drill and then having a fire. What have you and your team learned about reacting to an emerging unknown threat?
I think we need to plan for the long haul. Next time this comes around, hopefully that will be in the very distant future, that we have a limited amount of time to do really emergency measures where we are reacting with little data. But as soon as we start collecting that information, we need to revise our policies and really be as data-driven as possible. But we're in a much different place now than we were at the beginning of this pandemic, fortunately. A transition from very sick patients with severe respiratory distress to the majority of our COVID patients now who have very mild symptoms. It's been transformational.
And let's talk about that. The San Francisco Department of Public Health said our goal is no longer to prevent every case of COVID. Instead, the goal is to prevent the worst outcomes of the disease, such as hospitalization and death, and also mentioned keeping essential services open is key. What then, Doctor, do you say to people who still, in a way, fear for their lives when it comes to sending their children to school or going to the grocery store?
Yeah, first of all, I understand people's fear. We have been through a lot, and it's natural. We're human. It's normal to continue to fear, even out of proportion to our current threats. But we've got to move forward, and I think part of moving forward is to really realize the harms of some of our COVID restrictions. So when they were necessary, when this was a terribly threatening disease, when we didn't have vaccinations, those sort of restrictions were justified by the benefits that would accrue to them. But they are no longer. When we are seeing, really mild disease, when we have widespread access to vaccination, it's no longer justified to, keep kids home from school or close our homeless shelters or have people stay home from work when what we're trying to avoid is really bronchitis or an upper airway infection similar to the common cold. So we really need to embrace the good news in this turn Omicron has taken, the turn COVID has taken with this milder variant of Omicron, and really make a concerted effort to get back to pre-pandemic living.
I remember the day World Health leaders announced that this was in fact a pandemic. I had to Google it just to make sure that I knew what pandemic meant. Now we're hearing another term, endemic. Can you explain sort of how and when does the pandemic shift to an endemic, and what does that mean?
Excellent question. That's really when we no longer see these surges in hospitalizations that overwhelm our system. The disease remains, COVID will remain, and there's lots of animal reservoirs. There's no question it is with us to stay. But when it's endemic, we don't shut down society for periods of time. We don't expect to see large surges with a lot of people sick. And actually, this last surge, which it looks like we have peaked and are now in the plummet phase, we were not overwhelmed, actually. As Grant Colfax noted yesterday, in January of 2021, there were 155 deaths from COVID in San Francisco. January of 2022, there have been 5. And our hospitals remained, we had robust capacity throughout, as he himself noted yesterday. So these are indications that we are going to be okay, that this disease has really taken us forward into the endemic phase, and we need to pull back from our pandemic restrictions.
Let's focus on what's happening in likely the weeks to come. More people than at any other point in the pandemic that I know, and that this is fact, who were vaccinated were getting COVID in the past, let's say, month or so. When doctors say we've hit or maybe just passed the peak, does it mean that we have the same number of cases on the back end as we did of the front end of this Omicron surge?
Cases will probably fall much faster. So we have Omicron is quite a bit different in that case numbers have gone up exponentially, but then if we follow the same pattern as South Africa and other places, they will just drop off a cliff precipitously. And that's what we are expecting here. But on the point of case counting, we really do need to get away from that and focus on serious illness and death. I think our case counts were exponentially higher than anyone anticipated in the Delta era, but we actually fared much, much better than we did with Delta in terms of serious illness and death.
All right. Well, Dr. Jeanne Noble, I feel like we could talk for an hour. A heartfelt thank you to you and your team there at UCSF. I know it's been a very long 2 years, and thankfully, according to your words, we're starting to maybe come out of it. Thank you again for joining us.
Indeed. Thank you.